The topic today is really to discuss our reopening plan for our K-6 families. We have done everything we possibly can to try to meet the expectations and needs of our families. We needed to provide a in-person learning option and a virtual learning option. I encourage you to view this segment so that you can understand the dynamics of this plan that we're proposing for the November 12th start of the second market period. And so we've proposed a plan to bring students back in, but also to provide a virtual option. Some of those details will be discussed later in this video. But we just want to encourage you to take the time to look at the video. We will also be sending out a commitment letter to each of our elementary families where we're asking you to commit to either for being in-person learning or virtual learning. So without further ado, let's get started. Thank you.
In this presentation, we're going to talk about reopening goals, reopening timeline, understanding COVID, following metrics, in-person learning for marking period 2, virtual learning for marking period 2, and the next steps. Spring-Ford Area School District's reopening goals include using the guidance of state, federal, and local government to provide both in-person and virtual options for families. Spring-Ford will prioritize the physical and emotional health of more than 8,000 students, 1,100 employees, and 5,400 families over all other concerns. The current kindergarten through 6th grade reopening timeline includes the opening and closing of the commitment survey and updated schedules. Spring-Ford Area School District will prioritize the physical and emotional health of more than 8,000 students, 1,100 employees, 5,400 families, and 50,000 residents over all other concerns. Through this presentation, we will use terms such as close contact, contact tracing, quarantine, and social distancing. It is important for families to understand such terms and definitions. As well, we ask families to understand the following virtual learning terms. In person, students and employees return to full-day in-person school. Virtual instruction, instruction that is taking place from home outside of the school building. Live stream, students access synchronous instruction from home by listening to and watching their classroom. Cyber learning offers individualized instruction and flexibility so that students and families can find a schedule that works best for them. Spring-Ford's COVID Task Force reports required information to the Montgomery County Office of Public Health and the superintendent. The task force includes individuals from the district office, medical professionals, and building principals. Spring-Ford school nurses have completed hundreds of hours of COVID-specific training and continue to utilize medical journals and meet with medical professionals to better understand COVID-19. In response to school leaders' need for additional guidance as to the risk of COVID-19 transmission in their communities, the Pennsylvania Departments of Health and Education are providing recommendations to pre-K to 12 schools when making decisions related to instructional models during the 2020-2021 school year. For ease of use, once per week, the Department of Education will publish a list identifying the level of community transmission in each county over the most recent 7-day reporting period. Those levels will include low, moderate, and substantial. Spring-Ford will use the level of community transmission table when considering plans to move to in-person learning. In moderate, schools may return to in-person learning while following a plan that will reduce the number of students in the school buildings. Though both Montgomery and Chester counties have remained at the moderate level for nearly 6 weeks, it is important to note that a significant and/or widespread outbreak may require moving to a more remote-based model more quickly. While our area has remained consistent, it is possible to move between low, moderate, and substantial weekly. Should the county move from moderate to substantial, schools will return to virtual learning for all students. In this example, Montgomery County moves from moderate to substantial on November 30th. On November 30th, all employees and families would be notified that Spring-Ford Area School District is moving to virtual learning starting December 1st. Notification will be sent via Skylert phone call, email, and text message. In addition, notifications will be posted to the district's website, social media accounts, and will be sent to local news outlets. The district will monitor county numbers and will plan to return to the in-person learning after 2 consistent weeks in the low or moderate range. Spring-Ford Area School District will use the guidance of the state and federal government, as well as support from the Montgomery County House of Public Health in planning to reopen schools in person. All students and employees will wear masks at all times while in school, except during lunch and mask breaks. How will mask wearing be enforced? Students will be offered a mask if they do not have one. If they fail or refuse to wear a mask, they will be sent home. Students are expected to attend school wearing a mask when they are dropped off or when they load a bus. If a student forgets a mask, one will be provided. Students who have medical exemption must go through an individualized health plan or 504 service agreement process, or have a documented disability that precludes them from wearing a mask. Desks will be distanced to the extent feasible, though will not be able to maintain a 6-foot space between students throughout the school day. All desks will face the same direction. In this example, we see a pre-COVID elementary classroom setup where desks are grouped together to encourage collaborative learning. In this example, we see a current elementary classroom setup with all desks facing forward. In-person lunches will be bagged grab and go. Depending on the school, the cafeteria will be set up with desks spaced 6 feet apart or with 6-foot tables. In this example, we see a current cafeteria setup with desks spaced 6 feet apart. In this school, the lunch space spans both cafeteria and gym space. Outdoor recess will take place whenever possible. Students who participate in outdoor recess are not required to wear face coverings as long as the 6-foot social distancing guideline is followed. If students are within 6 foot of each other, wearing a face covering becomes necessary, even outdoors. If outdoor recess is not possible, recess will take place in the classroom. Students and employees will be required to wear masks during indoor recess. To maintain contact tracing, students in 5th and 6th grade will not have outdoor recess. Students will wash hands or use sanitation stations before and after recess, and any time equipment is shared. Equipment will be cleaned daily, but may not be cleaned between each use. Students will receive mask breaks throughout the day. Mask breaks will take place when students are at least 6 feet apart to last no longer than 10 minutes. For example, an elementary classroom may have a designated mask break area for students to take individual breaks as needed. Class changes will occur normally, and masks will be worn at all times. Specials will take place in the homeroom, eliminating the need to move throughout the building. All students with special needs will change as needed. For grades 5 and 6, switch teachers will change their rooms. Students will not change. Specials will take place in their assigned rooms. These limited class changes will be coordinated at the building level. All students with special needs will change as needed. Students will not be socially distanced on school buses or vans when transported to and from school. Students will have assigned seats to allow for contact tracing. Drivers and students will wear face coverings at all times. Buses will be wiped down between each run. Deep cleaning will be conducted midday, and buses will be wiped down again each evening, allowing chemicals time to sit overnight. Windows will remain cracked or opened throughout the ride to circulate fresh air. Spring-Ford will follow normal seating guidelines with no more than 3 students to a seat. Our maintenance staff will follow EPA-approved guidelines when sanitizing and disinfecting our schools. All district and contracted custodial employees have been trained according to follow the same procedures outlined in our Spring-Ford Area School District Custodial Manual. The manual is up to date with all cleaning products used, processes for cleaning in designated areas, and frequency of cleaning activities. The manual outlines specific daily processes and cleaning products used for sanitizing and disinfecting in classrooms, bathrooms, locker rooms, hallways and stairwells, and cafeterias. All parents must review the following checklist prior to departing for a district building each morning. If one of the following symptoms are detected, the parent should not send their child to school: fever of 100.4 or higher, cough, shortness of breath, difficulty breathing, a new loss of taste or smell. If 2 of the following symptoms are detected, the parent should not send their child to school: chills, fatigue, myalgia, headache, sore throat, congestion, nausea, vomiting, or diarrhea. Employees will follow the same daily checklist as parents and will continue to complete required daily return to work forms. Springford has secured necessary PPE and cleaning materials to ensure a safe return to school, including, but not limited to, disposable masks for students who forgot or soiled their mask, disposable gowns, gloves, goggles, thermostats, MERT kits, sneeze guards, disinfectant wipes, and hand sanitizer.
As part of the COVID-19 task force, the nurses have had meetings with Michelle Masters. She's encouraged our assignment of a few COVID liaisons in our district who streamline the reopening process of positive COVID cases in our school. The Springford liaisons report directly to Michelle or to one of the 2 other directors for guidance with each individual case. While the roles of the Springford COVID liaisons differ from those from the Department of Health, the 2 collaborate together to best prevent the spread of infections through our schools. We currently have 3 COVID liaisons at Springford: Nurse Erin Lewandowski at the elementary level, Nurse Jacqueline Gospodarek at the secondary level, and Athletic Director Mickey McDaniels for our after-hours notifications. The system they have developed has proven to be efficient thus far, and they will continue to evolve the process as needed. What happens when somebody gets ill at school? Once a nurse is notified of an ill student at school, she will meet the student in a triage area to assess for symptoms of COVID-19. The Department of Health has provided all school nurses with an algorithm to assist in determining whether or not the student should be excluded from school. This algorithm will be used in addition to the current standing orders from our district physicians. If a student or staff member presents with 2 of the top symptoms under the first bullet, or 1 of the bottom symptoms under the second bullet, the Springford nurse will comply with their recommendations to separate the ill person from the general population. Each building has a designated area for the care of a symptomatic person, which we have termed the health annex. This area will separate ill persons from any high-risk students or staff members in the building until the ill person can be taken home. Students going home from the health annex will be brought out to their parents through a designated exit door. We will request that parents not enter the building for pickup. So when can a student who gets sent home return? In order to return after being sent home through the health annex, which means that you are exhibiting symptoms of COVID, one of 3 scenarios must occur. First, the ill person tests negative for a COVID test. Once the test is negative, if that person has improved symptoms and has no fever, you'll notice the term afebrile on the slide. That means without a fever. So improved symptoms, no fever for the past 24 hours without fever-reducing medicine, and has tested negative, that person is ready to end quarantine and can return to school. The second scenario, if the ill person does not take the COVID test or tests positive, the person must isolate at home for 10 days after the onset of symptoms. Once that isolation period is over and the symptoms have improved and there's no fever for 24 hours with no fever-reducing medicine, that person is ready to end quarantine and can return to school. The third scenario is a little different. The ill person has a documented medical condition with an individualized health plan that the physician determines is the cause of the excluding symptoms. This is called a differential diagnosis, which is listed up there. For instance, if a student with asthma presents with cough and difficulty breathing, the nurse will complete an assessment and follow the student's individual health plan for treatment, which may include the use of an emergency inhaler. If the student improves after treatment and does not exhibit any other COVID-related symptoms, this student can remain at school. He has a documented differential diagnosis of asthma that explains his symptoms, and the treatment plan has worked. If the same student does not improve after the use of his emergency inhaler, he may be sent home for his asthma, perhaps to use his nebulizer at home. If symptoms improve, this student can return to school the next day because, again, he is not exhibiting signs of COVID. He has a documented differential diagnosis that caused his symptoms. However, if this very same student presents with a cough, difficulty breathing, and a fever, the student would be sent to the health annex and required to follow the guidelines seen here for quarantine. The reason is that fever is not a typical symptom of asthma, so the differential diagnosis does not apply. It's important to realize that a cold is not a differential diagnosis, nor is a stomach bug. A differential diagnosis must be documented as a health condition in the student's health record in order to be used as a return to school option. Now, there may be a situation where a student has an illness that requires being sent home, but is not necessarily indicative of COVID-19. For instance, a student presents with a fever greater than 100.4. The student has no other symptoms on the COVID list. We will send the student home ill based on our doctor's orders, but not as a COVID quarantine. Fever was one of those symptoms that requires 2 or more to quarantine for COVID. So provided that no other symptoms evolve, this student is allowed to return to school once he's fever-free for 24 hours without fever-reducing medicine. As you can see, there's many factors to consider with each person that presents ill at school. In each instance, the school nurse will use her assessment skills, she'll use the medical background and health history of the ill person, and the COVID guidelines for exclusion to determine how to best exclude from and return to school. Typically, a person will not be in school when they test positive because quarantine is required while waiting for test results. So when we hear that a person is COVID positive, our Spring Forward COVID liaisons need to collect certain information to provide to the local health department. The purpose of this is to determine what is called the incubation period or the infectious period of the positive case. The incubation period is the time between exposure to an infection and the first appearance of symptoms. We know that with COVID-19, a person in this pre-symptomatic period can still spread the infection to others. So calculating the probable days of being infectious will help us determine if anyone else at Springford was potentially exposed. Meanwhile, the positive case must now isolate at home, but the end date for her isolation is dependent upon whether or not she has symptoms. As you can see on this slide, a person with symptoms and a positive test result can return 10 days after the start of symptoms, as long as fever and the symptoms have resolved. The test date in this case does not matter as far as the end of isolation date is. Again, the presence of symptoms tells us that this person is probably already 2 to 5 days into the incubation period once the test was collected. On the other hand, a positive case with no symptoms must wait a full 10 days after the PCR test is collected, due to the fact that we are unable to assume how far along that person is in his ability to spread the virus to others. A positive case in our district will be contacted by the nurse or the Springford COVID liaison and by the local health department. We will work together to help with the isolation rules. What happens to a close contact? First of all, a close contact is anyone who was within 6 feet of an infected person for more than 15 minutes with or without a mask. Because of the incubation period and the possibility that COVID was being spread prior to us even knowing that anyone was sick, we must include any contact that occurred up to 48 hours prior to the positive person's symptoms. The Springford COVID liaison must work with the local health department to identify which students spent time within 6 feet of the positive case in every classroom, on the bus, and in any Springford-related extracurricular activities. Since in this plan, Springford is not able to guarantee social distancing, there will be significant numbers of close contacts for each positive case. These close contacts must be quarantined for 14 days. This quarantine period begins on the last date of exposure to the COVID positive individual. At this time, the Pennsylvania Department of Health recommends that all close contacts take a COVID test during their quarantine, but it's important to realize that a negative COVID test will not shorten the quarantine time for a close contact. Because of the complexity of contact tracing and the ease with which COVID is able to spread, we urge all students and staff members to stay home if you're not feeling well. If you remain home with new symptoms of an illness and improve on your own, you can return to school. But if you come into a building with symptoms of COVID and the school nurse has to send you out, one, you're potentially risking the health and safety of others in the building, and two, you're now required to quarantine until you have met one of those guidelines set by the Department of Health. A member of the Springford COVID Task Force will work directly with anyone who tests positive and anyone who must quarantine as a close contact. The local health department will also be in touch, as we said, for assistance with contact tracing. In compliance with confidentiality and privacy rights based on HIPAA and FERPA, a person's private health information will not be discussed with anyone else. Unless you are notified to be a close contact of a positive case, please do not ask your building nurse, your principal, or any member of the COVID task force for the personal health information of anyone else. However, the Springford Area School District does have a plan in place to keep the public notified of the level of COVID-19 spread in our community.
Springford will share COVID-related information and educational resources each Monday with the updated level of community transmission for both Montgomery and Chester counties, the number of confirmed cases in our schools, and the total number of cases in the Springford footprint. Individuals identified as being in direct contact will be directed to quarantine. Information will be sent to those individuals directly from the COVID task force. Learning while quarantined will be handled in one of two ways. If a student is out of school with any illness, COVID, standard flu, sinus infections, etc., their parent or guardian should call the school's attendance line to report their student absent. As with any other year, they will be expected to make up work and should do so by working directly with their teacher. If a student is quarantined or self-quarantined, but the student is not ill, they should complete their schoolwork from home. Springford Area School District will propose a virtual option for families who desire a home learning option through the second marking period.
In our current learning environment, teachers and students are engaging in instruction via Zoom and through Canvas. Students are logging in for morning meeting, for instruction in English language arts, math, and so forth throughout the day, and they're bouncing between Canvas and continuing work within Canvas, and also between direct instruction with Zoom with their teachers as well. This mirrors a similar model that we would have in our typical classroom, because in a typical classroom, our teachers aren't lecturing 48 minutes per period. Instead, they may have a mini lesson where they would lead direct instruction in 15, 20-minute intervals, and then students would then work independently or in guided reading groups and so forth. We've prioritized for K-6, the students, giving the opportunity for students to engage in activities such as social emotional learning that will support the development of a classroom community and help support students through this time. So throughout activities such as the morning meeting, students will have the opportunity to engage in whole and small group instruction to support both their academic needs and social emotional needs. One of the things that we want to be really clear to share with you and be very transparent is that, unfortunately, due to staffing, there's no way that we can recreate the exact same virtual experience in the second marking period as we're creating in the first marking period. With bringing all of our students back into school, we know that this will require all of our staff. So we are committed to trying to provide as best of an opportunity for students to continue learning virtually as possible. But just please note that the virtual experience will look different in the second marking period than it currently does now. Our plan for K-6 is to make every attempt possible to secure dedicated virtual teachers so that we can recreate this environment as best as possible for students. For K-6, we will be using the Parent Commitment Survey to identify our staffing needs. It is going to be critically important that all families respond to this, because we're going to be using each response to make sure that we can match students up with the correct environment for them. We are making, as I mentioned earlier, every attempt to make sure that we have dedicated content virtual teachers for our students who want to pursue a virtual option and continue in that environment. Specials such as art, music, RamQuest, etc. will be available through Canvas and will be asynchronous. This is because we have to have our specials teachers in the building, and it's going to be very difficult to be able to offer live synchronous instruction in those special areas. But we're working very hard to secure that for all of our content areas so that students will expect to engage with a dedicated virtual teacher for morning meeting, English language arts, and math, and so forth, similar to the model we currently have. Take a minute to talk about the pros and cons of these models. We have had a team that have really worked through the various models and the various ways to deliver virtual instruction in this environment, and we have weighed and identified all of the pros and cons that exist with each scenario. One of the pros that we've identified is that our families then have an option for both in-person, cyber, and virtual learning. This is a very familiar model to our families in K-6 because it's very similar to what we are currently doing. As I mentioned earlier, there are a few nuances, a few changes, such as the specials, which would look different. But if we are able to achieve this, we would have the dedicated virtual teachers, which could provide live instruction and students using both Zoom and Canvas in a similar model that we're currently using. We also feel that this is the most engaging approach for both the in-person learner and the virtual learner. This is something we really looked at very closely with each model because we want to provide as equitable of an experience for both learners in both environments. What this opportunity affords us is the opportunity for students and teachers to be focused in one single environment. For example, the students who are in person, the teacher can give their undivided, dedicated attention to the students who are attending in person. Same thing for the students who are attending virtually. We will have one teacher who will then be dedicated to your students in the virtual environment. So we don't have teachers managing multiple environments at one time. Our concern with that is that it would lead to a diluted experience for both learners. So we feel that having the dedicated teachers would assist in this. One of the areas of concern that we want to be very transparent with is because of the staffing and because it requires all of our staffing to be in the building to make in-person instruction work, students cannot expect to have the same teacher and classmates as they currently do right now. We know that this is a challenge and a limitation. We know that this is not something that is looked on favorably. As a parent of children who are elementary age as well, I know how important this connection is with your families and with your teachers. So we recognize and understand that this is a limitation, but please know that we are going to make every attempt possible to maintain consistency if we can. Unfortunately, we just know that this is one of the areas that in order to make both models work, that there may be some shifting that's going to occur, and that means that students, teachers, and classmates may change. One aspect that's critically important to making this plan work is the parent commitment survey. We feel at this point, based on the survey data that we received a few weeks ago, that we can make this plan work. But we need updated information and commitments from our families, depending on which option they're choosing. From that point on, we then have the hard work of making the puzzle work. We need to look at staffing and compare it with your student needs. So it is critically important that all families complete the parent commitment survey so that we have up-to-date and accurate information based on your preferences so we can determine planning moving forward and put together the best plan possible.
Springford Area School District will continue to be the district that every parent would choose as their child's educational provider. Starting November 12th, 2020, the Springford Area School District will remain virtual or in-person only if Montgomery County remains low or moderate. Springford Area School District will move back to the virtual for all students if the county moves to substantial. From November 12th, 2020 through February 1st, 2021, Springford Area School District will monitor the level of community transition table and will provide updates to Springford families, employees, and board members each Monday. Starting February 2nd, 2021, if Springford Area School District remains in low for the final 4 weeks of marking period 2, the district would propose the elimination of virtual in marking period 3. We must remain in low from January 4th to January 29th, and board approval will be requested at the January 25th, 2021 meeting. Families of students in grades K through 6 should make note of the following dates. September 30th, 2020. Family Commitment Survey for grades K through 6 opens. October 4th, 2020. Family Commitment Survey for grades K through 6 closes. October 30th, 2020. Updated classroom assignments will be posted in Skyward. November 5th, 2020. Updated school bus schedules will be posted in Skyward. November 12th, 2020. Students return to in-person learning. February 1st, 2021. Last day of marking period 2. February 2nd, 2021. As long as Springford Area School District remains in low for a minimum of 4 weeks, students return to in-person learning or transition to Springford Cyber. Please log into Skyward to complete the return to school commitment for each student in kindergarten through 6th grade. Any student without a completed survey will be rostered into an in-person class. The commitment survey will close at 11:59 on Sunday, October 4th.